Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is NIH Data Management and Sharing Policy for SBER, Implications for Researchers and IRBs. It's presented by Desi Kirilova and Dr. Diana Kapaszewski.
The learning objectives for today are, we will try to describe to you the reasons for and the goals of the NIH's new 2023 Data Management and Sharing Policy, as well as how it fits within broader efforts related to research, transparency, and access to data. We will review the most salient points of the new policy, especially with an eye towards social behavior and educational researchers and IRBs. And we'll learn about some guidance that the NIH has put out to help people and institutions comply with the policy. And we'll talk about how data repositories in particular and their resources can facilitate meeting the policy's objectives. Now, what are the things that make it truly different and seismic, as one recent publication called it, in the context of this gradual opening up of NIH-supported research? For one, it's the NIH's attributes themselves. The reach of that particular federal funder is huge. The NIH annually funds 300,000 individual researchers and 2,500 institutions. It funds, on the face of it, strictly biomedical research, but there's a lot of SBER adjacent work folded into, multifaceted studies that are also supported by the NIH. It has long served as a model for US-based other federal and then, of course, private funders. And because of the large number of global health studies that the NIH also funds, there are international repercussions as to both the way researchers do research and the expectations that they try to meet, and the way then participants or patients as well can expect to have access to the outputs of these studies. The scope of the policy, as I already alluded to that, has been greatly expanded. Now, the new policy will apply to all NIH-funded studies that generate scientific data, and I'll talk in a minute about what that phrase means. And the policy also applies to all types of data, no more specific limitations to only certain types of data. And the comprehensiveness of the effort by this federal agency has also been truly different and remarkable. The infrastructure commitment, the dedicated funding and resources across all of the pieces of the NIH that we have observed in even just promoting the policy has been tremendous. So all of those things together do make the new policy very different in its scope.
Thinking about that nexus between NIH data management and sharing policy and IRBs raises the question of what role IRBs can play with regard to educating scholars about data sharing and promoting good data sharing practices. So we can think about IRB and researcher interactions over data sharing along two dimensions. So the first is what we might call the mindset IRB personnel bring to such conversations. And the second is more concrete, what kinds of issues IRB personnel look for in researchers' materials and speak with them about. So with regard to that first one, the mindset, we think it's important for IRB personnel to consider both the risks and the benefits of sharing research data and speak about both with researchers. And indeed, in conversations that we've had with IRB personnel from various years now, we know that IRB personnel have begun to adopt this kind of mindset.
In closing, I also invite everyone to review our content offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development. That concludes our webinar. Everyone have a great day. Thank you both so much.
Thank you.
Bye.
Thank you. Bye.